Hi everyone, my name is Christian, as Alan already introduced myself, and I'm here today to talk to you about orthotics and shoe modifications, as well as potential footwear choices that you can make to help you reduce pressure and discomforts in your feet due to arthritis. My background is Orthotics, which means I am able to modify shoes. That's what we're trained in. We usually go through a program, a 4-year program at university, to be able to learn how to look at the body and the alignment. It's a kinesiology program or a science program that you take, and then afterwards we take a year-long further training in the field of Orthotics to allow us to really understand how the biomechanics of the body can work with feet and orthotics. So that's my background. I'm a certified podorthist, and my company, as Alan introduced myself, is Foot Solutions. We have a couple locations here in Vancouver, and you're more than welcome to connect with us there. Now let's move into the first slide. Now, what is an orthotic? An orthotic is basically a device that's designed to help improve the alignment of your foot. Now, if your foot rolls in, which means, as you can see on the, can you see my mouse pointer? I'm not sure. Is that it?
No, I don't think they will be able to.
It doesn't do. So if you look at the slide on the left-hand side, which says pronation, you can see on the far left there's a foot impression. That's a flat foot. Now that foot there it has a very low arch, meaning that most of the time we will see a foot that collapses quite substantially, and that requires oftentimes a little bit of additional support to prevent the foot from collapsing and stretching the muscles and tendons out. That can cause a lot of discomforts, which we'll describe a little bit later. That can cause pressure on midfoot arthritis, or in some cases even on the big toe joint itself. On the right-hand side, the foot impression is a high arch, and that's the foot that rolls more to the outside. And really the purpose of the orthotic device is to fill in the gap between the bottom of the foot and the bottom of the shoe to help improve alignment of the foot. Now that can help reduce pressure on the ankles, the knees, and the hips through increased or reduce pressure on those particular areas. Now, if you have any questions, please do put them into the chat window, and we'll get to those at the end of the presentation. And I look forward to answering any of those questions for you. Now, one of the things that we see often is let me go to the next slide. Hallux Limitus. So that's one of the conditions that we see on a regular basis. And that's a condition where there's very limited range of motion. Now, when you look at the foot itself, now that's being the skeleton of the foot. I'm not sure if everybody can see that, but oftentimes what happens is that there's limited range of motion through the toe joint right here, and that can result in the foot causing a lot of pain in the first metatarsal joint right here. Now, in order for us to relieve some of that pressure, you can, depending on whether or not it's Hallux Limitus, where there's still a little bit of motion, and as a result of a collapsed arch, it can cause the toe joint not to move substantially in the front, and that can be helped by raising up the arch and improving that function. Whereas Hallux Rigidus is a different condition where usually you'll have little bony deposits that happen on the top of the toe joint, and that really limits the function and can be very painful when you're trying to walk. Now, both of these issues we treat differently. One of them we would treat with a more substantial orthotic device, and as you could see in the previous slide, there's a couple of different ways of creating orthotics. There we go. One is a corrective device. Now, a corrective device usually is made of a more rigid material. That can be plastic, or it could be in other cases it could be also a firm cork. Now, those devices tend to improve the function of the foot, and what we're looking at here is trying to prevent inward rolling or outward rolling of the foot that can cause discomforts in the feet themselves, and those are made of more rigid materials to help correct the alignment. Whereas when we talk about accommodative devices, which is something like this, this one is made of EVA. So EVA is basically the same material you'll find in the bottom of a running shoe. And with an EVA material, what happens is that you end up with the device being softer. So there's more flexibility in the material itself. As you can see, I can even bend it. And that's more accommodative, meaning that if you have a foot that can't move up and down substantially or can't be corrected because of the fact that you have a lot of discomfort by doing that correction, but we need to accommodate the actual current position, then we may use something like this. In certain cases, the foot is very insensitive as well, which is where we would use a more accommodative device as opposed to a more rigid device. And oftentimes, as you can see in my notes right there, severe ankle deformities will usually require more of an accommodative device that's not trying to correct the foot positioning. Whereas when we have a foot that collapses quite a bit through pronation, we're looking at a more corrective device that tends to be a little more solid to keep the foot in better alignment. So a corrective device is usually made of more rigid materials to correct the alignment of the foot or ankle. And that prevents, that way, also further pain up the legs, because when your foot isn't rolling in or out as much, it reduces stress on the IT band. It can help improve the alignment of the knee joint itself, which sometimes if there is an issue with kind of the foundation of your body, can cause the alignment to be off. Whereas with an accommodative device, that's more designed to prevent further degeneration of the foot. So we're not looking at correcting movement. We're really more looking at accommodating the foot where it is in its current state and preventing it from degenerating further and causing the arch potentially to drop more, or at the same time, potentially to become more painful as a result of there being more movement through the joints. Now that can help keep the foot, it basically helps keep the foot in its current position. Now Hallux Limitus, let's go back to that. We can read through those slides real quick as well, just to allow people that are listening in to understand that a little bit better, because it's sometimes easier to look at it when you have pictures. Now the hallux, just to kind of make sure everybody knows what that is, the hallux is a big toe. And that's basically the toe that moves through the big toe joint. And if it's limited in its movement, what can happen is that the toe itself isn't able to raise up properly. And as a result, you may end up with a lot of discomfort in the first metatarsal joint, which in some cases, when it's rigid and there's arthritis in the joint, you may even end up with a potential bone spur on the top of the joint that can cause a lot of discomfort and pain. Now what we usually do with that is if it's a limitus, meaning that there's still movement and potentially is limited due to the alignment of the foot, then we would use a corrective orthotic device to help prevent the arch from dropping too much, and that will help improve the function of the toe. Whereas if it's a rigidus issue, then sometimes we will use orthotics, sometimes accommodative, sometimes non-accommodative, to help relieve pressure on the bottom of the big toe, because that's where occasionally pressure can be increased, the load force can be increased there, or even on the other metatarsal heads. And the metatarsal heads being the other little bones that make up the ball of the foot, because when you can't push over your big toe, you tend to start to walk sideways over the side, or potentially even along the inner edge of the big toe joint. So one of the ways to really help improve the function of the toe would be to use a rocker sole shoe. This one is one example as more of an athletic profile. This is the Hoka, and as you can see, it's quite stiff in the front. I can't really push it up. Even when I try to force it up, it doesn't bend, and it has quite a bit of a rocker profile through the front. Stable in the heel, but rockered in the front. And what happens is now if you're moving forward, instead of the material pushing up against your toe, causing it to rise up, because the sole is rigid, it's just going to rock away and relieve the pressure on the toe joint. So that's one way to really improve the function of your walking by using a rocker sole shoe. And next one would be midfoot arthritis. Now, midfoot arthritis, as you can see on the X right here, those who are listening in, you can't see that, but what we're looking at here on the picture, where the arrow is, that's what that is the midtarsal joints, and those are the bones in the middle of the foot right here, which are being squeezed, and as a result, they can cause a lot of discomfort most of the time on the top of the foot. So you'll notice the pain on the top of your foot. don't necessarily notice it on the bottom of the foot so much. So it's not like plantar fasciitis, which is an issue that happens on the bottom of the foot. You'll actually feel a lot of discomfort on the top. And now how we treat that, if arthritis is present, when you do an x-ray to finalize those results, how we treat that is again through more of an orthotic device to help prevent the arch from dropping. When the arch drops down, what happens is that the mid-tarsal joints are being squeezed together, and you end up with the joint spacing being reduced. In some cases, the cartilage is completely missing, and then you end up with a lot of discomfort there. And what you need to do is help support the foot from the bottom to keep that mid-tarsal joint from falling down. Now, the reason this is also, in some occasions, it's a direct result of hallux rigidus, because your big toe joint can't move, and maybe the big toe joint isn't even painful. What happens is that you start to move in the middle of the foot, through the middle of the joints, to that way, be able to push off normally. And as a result, you get that squeezing of the joints here that can be very uncomfortable. Other causes may be, in some cases, it may be a flat foot. When your foot really collapses and there's a lot of pressure on it, that may be causing some discomforts there as well. And that's basically, another reason why you would want to add extra support there to help raise their foot up through an orthotic device. Either like this, or obviously, this maybe has a slightly better picture. And as a result, you reduce that pressure, you reduce the pain, and you can move more normally. And then if there's hallux rigidus, that's a direct result of that as well. You'll have to add a rocker-soled footwear to the mix to make sure that you can normally walk off and reduce some of that discomfort there on the top of your foot. Other options there would be also, and that's something that works for hallux rigidus as well, is this little thing right here. You may not be able to see it when you're driving, but it's what we call a Morton's toe extension. And when you look at that, it's a kind of a carbon fiber plate, which can be glued to the bottom of an orthotic, or can also be added inside the footwear of your choice to help stiffen the sole of the shoe, and that prevents the big toe from flexing upwards by being a very rigid device in there that reduces the upward motion of the foot. Now, if you look at Morton's toe extension, that will make sense, and you can have a look at it there. If you have more room in your shoe, you can also use little plates like this. Now that's a spring plate, which is a solid plate, again super stiff, and it helps to stiffen the shoes to help prevent flexion of the toes. And those can be added in the sole of the shoe, or it could be added on the underneath an orthotic or thicker insole to prevent it from feeling uncomfortable on the bottom of the foot. Next item on the list that we see frequently is hammer toes. Now hammer toes don't always have to necessarily be arthritic, but in many cases, sometimes they do become more arthritic over time, where they are locked in place, meaning that the toe itself doesn't move much at all, and you can't stretch it out anymore. A lot of reasons for hammer toes occurring is because of the fact that they are part of oftentimes it's a direct result of the footwear that you wear. Shoes that you wear do have an impact on whether or not you get hammer toes. In some cases, it may also be a big toe that's gravitating sideways. So if you have your big toe going sideways, causing kind of a little bit of a bunion on the side or on the top of the foot, that may cause sometimes a second toe to move out of the way. And there's different ways we treat these through orthotics or either shoes. And what you can do with this is, because it can cause pain on the bottom of your foot, what happens with the hammer toe is, as you can see in the picture here, well, not if you're not on the video presentation, but what happens is that you have the first toe joint, which basically moves backwards and curls back, which can cause the metatarsal bone, which is the little bone that makes up the ball of the foot, to drop down into the ground. And as a result, you end up with a lot of pressure on that spot, which can cause a lot of calcing around the area. Now, as you can see on the other picture, to your left there, that's an orthotic device that has a cutout under the metatarsal bones. And what we do is we take the orthotic device, shape it to the arch of the foot. In some cases, add a metatarsal support. A metatarsal support is a little pad that kind of looks like this, and that's designed to help improve the the pressure relief on the ball of the foot. It's just a little pad that raises up the metatarsal arch, and that's the arch that's behind the ball of your foot to help prevent pressure on a particular area. And we do cutouts in some cases, like the one in the picture here, to help relieve that pressure as well by that way reducing pressure on the calloused area. And it's really done on occasions where we feel that the bone is being stressed too much or it's loaded too much, and that helps to relieve the pressure on that particular area. Now, if you experience that rubbing on the toes, which can happen as well, oftentimes when you look at hammer toes, the shoe box may not be deep enough, and you may require something that has a little bit more depth inside to relieve the pressure on top. There's different brands out there like Drew, PWA Minor, also ProPay, and a few others that have extra depth added to the footwear, and those you can look at. They also come in width. If you need more space, going into a wider shoe can sometimes add a little bit more volume to the footwear. In some cases, they don't actually have the sole much wider, but there's more depth this way. Excuse me. And in certain cases, like the Drew shoes here, this one is the Lotus, which is not necessarily the prettiest shoe, but you can see that it's a little bit deeper through the toe box right here. Oh yeah, there we go. I can't do the line properly. And in this particular product, we also have two removable insoles. There's one, and there's two insoles that come out, which means that if you have to create more room for your foot inside the footwear, you can remove one of the insoles, put the other one back in, and it gives you some additional space that prevents rubbing on the top of your toe. And that's a great way to help relieve stress on the top, while cutouts and other means of modifying an orthotic device help to relieve pressure on the bottom. Knee osteoarthritis is definitely something that can be helped with orthotic devices. What occasionally happens is the fact that when you look at the cartilage, there's two compartments on either side, and these each one of them could be worn out potentially. And what we look at here is looking at reducing the amount of pressure on the cartilage by aligning the foot properly, if that's the issue. And in some cases, the foot may be perfectly fine, and there may be potentially some muscle atrophy or perhaps some muscular issues in the upper leg that require the strengthening of the leg muscles to help improve the alignment of the knee, and the footwear or the orthotics may not make a difference at all. There's different ways of reducing pressure on that knee depending on what's going on. If the cartilage is already very worn out, then an orthotic can sometimes restore cushioning by being softer. It can help improve the alignment of the foot, which can also take the stress off the knee. And in those cases, if the alignment of the foot is related to the overpronation of the foot, meaning excessive inward rolling or outward rolling of the foot, then which is supination, then we look at improving that alignment to help relieve stress on the knee. If that's not the case, then we may be looking at either strengthening through a physiotherapist, or potentially other medical practitioners that can help you strengthen the muscles in your legs to help also improve stress on that knee, because shoes aren't necessarily always the answer. And there's also products out on the market today which have very cushioned soles. One of them being the Joya brand. Now this is a women's version right here. This is a very cushioned sole, so you got a lot of cushioning in there, and even the inside of the shoe is very soft, allowing you to go right into the cushion foam of the sole. There's no hard materials inside the footwear that can cause the impact to be substantial. And that's a great product we found works quite well for people with knee OA if it's in quite advanced stages. We've also had a lot of success with another brand called MBT, This can be sometimes a little bit too unstable for certain individuals, but we found these products to be quite good in relieving stress on the knee joint by being soft in the heel counter. And even there was a few studies a few years ago that showed that if a shoe is soft and doesn't cause the foot to be moved or pushed into a certain position, it allows people to walk more easily and more readily with the softer shoe, because then the foot can move as it wishes to help relieve stress and pain on the knee. And there was a few other products that came out to make that to go with that claim that we're helping reduce knee pain from osteoarthritis. Let's go to the next slide. There we are. Hip osteoarthritis. Now hip, again, that's pretty far away from the foot, and in that case it can be sometimes quite difficult to treat with shoes or orthotics, because the hip joint is further up the line, not allowing us to necessarily treat it as well as some other things. And if it's come to a point where it's basically bone on bone, oftentimes surgery is kind of the only way to treat it. You'll have to either replace the socket joint itself or do a full hip replacement. But again, softer shoes like the Joyas, which I was talking about before, can occasionally help relieve some of the stress and improve well-being and the walking amount over time, keeping you from feeling like there's a lot of stress on that particular part of the body. And if there's alignment issues with the feet that may be causing the hip to be out of line, potentially a leg length discrepancy may also cause more stress. So you want to probably have that checked out as well to make sure that there's not a difference in the leg length from the left to the right. Because if you do have leg length issues, then you may find yourself putting more stress on the one side, causing the angle of the hip to be off, and that can be addressed with either lifts inside shoes, or potentially if it's a really big lift that's required, then putting that on the outside of the shoe to help improve the alignment of that hip. And then just like knee OA, it's really more about helping to align the foot properly, making sure that it's not rolling in or out too far, or potentially making sure you have also stable shoes. Sometimes a soft shoe is not the answer. Occasionally you may have to have something that's very very wide in the back. As you can see with this shoe, the shoes, when you have a stable shoe, you want to have the outsole flare outwards instead of inwards. If you have a high heel shoe, let's picture a pump, for example. If you have a pump, those ones have very narrow, skinny heels, and those cause a lot of movement through the ankle, which then kind of finds its way up the line. Whereas if you have a shoe that has a sole that flares outwards away from the middle of the shoe, it helps to balance and stabilize the foot, which can also help reduce pressure on the hip itself, reducing pain and discomfort that way. And there's definitely a lot of different ways you can help improve balance through that type of footwear. Let's go to the next slide. Fused ankles. Now that's something that we see once in a while as well when it comes to rheumatoid arthritis. And with rheumatoid arthritis, we've seen full reconstructions of the foot as well to help keep the joints in place. I believe that's a little bit less of an issue nowadays because of drug treatments that are much better than they used to be. But if you have issues with range of motion, especially in oftentimes when you find that when you have a foot ankle that is fused, it doesn't allow the foot to dorsiflex very well, moving up and down, especially moving upwards, and as a result it makes it very difficult to walk. In this case, usually we don't necessarily look at orthotic treatments. Sometimes we do, to mostly accommodate it when the foot has had severe surgery on it, because we don't want to put stress on parts that are in the body and screws that are in the body that may cause them to be uncomfortable. So really, if we do go with orthotic devices in this kind of a case, it would be mostly to help make the foot feel comfortable and be accommodative, and therefore reduce pressure on the bottom of the foot, if there are any, like if you have callousing, or there may be potentially some other issues that are going on that need to be addressed, then we would use an accommodative device to reduce those pressure points. And the other thing that works quite well and has worked well in the past, again, would be the softer shoes. Rocker sole especially, the MBT has been working very well for that, because it allows the foot to kind of create that natural motion without having too much stress on the ankle itself. And that works extremely well for that particular foot. We've had some successes with Joya shoes. However, because Joya is very soft throughout, it can sometimes cause the foot to feel a little bit wobbly, potentially making it move too far to the left or the right, meaning rolling out or rolling in, and that can cause stress again on the ankle, which may sometimes make it uncomfortable. So that's one of the things to watch out for. Whereas MBT being a firmer front, so having a firmer sole in the forefoot, is usually a little bit more stable and feels more comfortable. I brought a few other things here as well, like an ankle brace right here. Now that's a brace that can, if you have ankle issues or ankle pain, or even arthritis of the ankle, this can help stabilize the ankle a little bit more as well, to help keep it in check and keep it from moving too much. It really does a very good job if muscles are weak around the ankle joint and don't allow those muscles to take over the function to help stabilize that joint. And that's a great way to help improve the support of the ankle and reduce pressure on that particular part of the body.